I had some really positive experiences on my psychiatry rotations. I also worked in Africa for a while doing infectious disease research, and I did some psychiatric research there. I'm the clinical director of a program called the Psychiatric Treatment Resistance Program. And we are a consultation-based service where we treat patients with difficult to treat conditions. So we will see patients with a variety of psychiatric conditions, such as mood disorders, anxiety disorders, post-traumatic stress disorders, catatonia. The first thing that we're looking for is diagnostic clarity. So many of the patients that we see have been diagnosed with a number of psychiatric conditions. First of all, we just want to make sure that the diagnosis is correct, and there are some diagnoses in psychiatry, like bipolar disorder, that can be very, very difficult to make because people have episodes during those disorders where it actually impairs the encoding of their memories. So there's some sleuthing that we have to do, sometimes getting medical records, sometimes talking to family members to make sure diagnoses like that have not been missed. What we're talking about are called interventional psychiatric treatments. These are things like transcranial magnetic stimulation, where we're using magnets to target parts of the brain associated with certain disorders, electroconvulsive therapy, which is still the gold standard treatment for severe depression. We also use a drug called esketamine. That's a derivative of another drug called ketamine, where patients have to be treated with that on site and observed by a medical professional for a couple of hours. So these are typically very different treatments than patients have been treated with or that they even know exist. It can be 1 to 3 treatments a week for 4 weeks, and then many patients also go on to do maintenance treatments where it might be once a month after that. I think most of all, we want people to be able to tell their story in kind of an extended manner. So our program has 90-minute visits. I think is a good way for us to show that we're listening, we trust what they're saying, and we're interested in learning more about them to make sure that we're going to pick the right treatment moving ahead. Sometimes we hit a home run with these patients, and it's absolutely incredible. They tell us that they have not felt this well since they were a child or a teenager. When I'm not at the hospital, you can probably find me outside. I like to just stay really active and spend time in nature. It helps keep me grounded.